Good morning to the Honorable Ministers of the Council, members of the media, online viewers, radio listeners via St. Maarten Gov Radio 107.9 FM, and respective radio stations island-wide. I'm Charity Dunker, and welcome to the Live Council of Ministers press briefing for today, Wednesday, January 12, 2022. At this time, I'd like to invite the Honorable Minister of Public Health, Social Development, and Labor, Omar Otley, to address you. Minister?
Good morning, Ms. Dunker. Good morning to my honorable colleagues. Good morning to the members of the media, the viewing and listening public. Today, we have documented 1,945 active cases. We have, unfortunately, 12 persons hospitalized. And based on the phased approach, we move to phase 2. As of today, there will be a business closure as of 11 p.m. Out of the 12 persons hospitalized, 3 are fully vaccinated and 9 are unvaccinated. I must reiterate, 2 of the fully vaccinated persons are there with COVID, not for COVID. Unfortunately, they are not exhibiting any symptoms. They went for other procedures and in the screening process found to be positive, but they're not exhibiting any symptoms. Once again, I would like to use this opportunity to reiterate the importance of the vaccines. Yes, you can contract the virus. Yes, we notice the spreading of the virus, but at the point, we are focusing on hospitalizations. We are focusing on death. There are some critical cases in the hospital, unfortunately, again, and my prayers go out to them and their families. All of these critical cases are unvaccinated. I am not trying to create a rift or a division, but my only option at this point is to try to pinpoint the importance of the vaccination. We have made vaccines available. We have made vaccines free. We have did pop-ups. We took people from CPS Saturday in, Saturday out, away from their family to promote vaccinations. We have created the MOI with the Health Pass for the nightlife businesses. We have created an MR where businesses can conduct testing on their employees, of course, on the expense of their business. And all of these is things that we put in place. All of these measures were put in place to combat the virus. Were all these measures followed? No. That's point blank simple. We were one of the only islands that had decent economic activity for the New Year's. Of course, this also contributed to the spread, but also we always promoted safe and healthy economic activity. We pleaded and begged with the nightlife owners to please conduct testing. They refused to. I have been pressured. I have been nonetheless approached by the Netherlands asking for a shutdown a while back. And I understood our financial situation. I understood the situation of St. Maarten, and I stood strong, and I asked the club owners and the nightlife owners to please understand the situation that we are in. Understand the situation that we are in. Let us do what we have to do. And at the time, everyone can promise because they want to remain open. But the fact remained they didn't follow through. And guess what? You didn't follow through, and based on the hospitalizations, we go to 11. So we're going to have to be upset, but now we're going to have to move in the interest of safety. I gave the labor aspect its time. Now we have to move in the interest of public health. Another thing I would like to reiterate on is persons that now we see the crazy notion that, oh, we accept thousands of tourists and we think that scaling back from 3 to 11 is going to help. Yes, it's going to help. Because let me tell you something. 99% of the hospitalizations are our people. They're not the tourists. 99% are our people. Hence the reason scale back and the phases were not based on active cases. It's based on hospitalizations. And we have 12 in the hospitalization. So if you can't see that we have an issue pending, then I'm sorry. Because we do. So everyone at the sound of my voice, if you can hear me, please consider vaccination. This is the way out. I'm tired of hearing, yes, but you can get it, but you can spread it. Look at hospitalizations. You take your flu shot, you can get your flu every year. We are seeing reinfections. We are seeing persons who had COVID being reinfected with COVID. Please, please, those at the sound of my voice, there are many today in the hospital. I hear stories from Dr. Holliday. I hear stories from different doctors that people who are in critical condition are now begging and pleading and wishing they took the vaccine. I don't want that to be you. I stood right here at this podium and I said it. I said we've been through Alpha, we've been through Delta, and we don't know what is coming. We don't know what's in store for any of us. And I told persons the vaccination is a form of preparation. And here comes Omicron. Omicron has been proven to not be as potent, not be as strong as Delta, but at the end of the day, with the numbers going up, we can expect hospitalizations. We are seeing who is target. The underlying conditions, the unvaccinated, are definitely being distraught by this. So I urge you, I plead with you, let us do what we have to do. We will continue to monitor everything. We are constantly discussing, constantly talking about new protocols. We are constantly finding ways to better improve our safety and at the same time continue some sort of economic activity each and every day. We are now, one of the biggest discussion that we are having is the entry protocols. I'm considering and looking at the demographics of who is infected, the ages that are infected, and so forth. To date, we have 7 clusters. I guess the Minister of Education will touch on this, but none of these clusters are schools at the moment. None of these clusters are schools. We are seeing some young kids infected, yes, but based on the results that are coming in, there are no mass clusters at school. So which means that parents are doing a good job when they realize that their kids have symptoms, they're taking them to get tested early, and fortunately, the transmission has not taken place widespread throughout the schools. And I can only tell you what is reported to CPS. Again, not here for no back and forth. I can only give you what is reported through my information body, the government's information body, the country's information body, CPS. And to date, for the week of last week, there were 4 incidents in schools. I'm sorry if I'm going into your thing, but this is definitely numbers. There were 4 incidents in schools. 3 were teachers. 1 was a student. Contact tracing has been done. So now there are no clusters within schools. I would like to touch on the, real quick, we are now administering vaccinations, speaking about schools, from 5 to 11 years old. You can register online. The link was provided and will be provided. And there will be a 21-day span between the first shot and the second shot for those that are 5 to 11. This is now another opportunity for us to get going, keep schools open, and continue our educational system. Speaking of which, we had 0 tolerance daytime controls. I would like to give you an update as of January 11th. Business type, supermarket, barbershop, salons, there were 38 controls, 32 complaints, non-compliant 6, 3 warning letters given, 3 verbal warnings. There were also fines. There were 2 fines given, 1 within the transportation sector, which is the tour bus industry, and 1 within the bus sector. Areas of compliance, all supermarkets were found to have staff wearing masks. There were some in violation of proper signage. So definitely 17 buses were controlled on Pondville. 6 written warnings were issued for non-compliance with out of these 17, and 2 fines were given as well when it comes to the transportation. So definitely there will be a continuance of 0 tolerance in the daytime. We are not just targeting nighttime activity, and I am confident with the scale back to 11, with the protocols in place, with the 0 tolerance compliance, in which I don't think that we need the inspectorate to fine us or to inspect us for us to do what we need to do at the end of the day, point blank, period. Some may not like it, but at this point, we have put all the tools in place for us to survive this COVID-19. So I look forward to any questions from the members of the media. Thank you.
Thank you, Honorable Minister Omar Otley, for your opening remarks. At this time, I'd like to welcome the Honorable Minister of Education, Culture, Youth and Sport, Dr. Anders Rudolph Samuel, to address you. Minister.
The people of Sint Maarten. Knowing that health is the most important, knowing that health comes first, and also knowing that face-to-face in-class instruction is the best thing for our students, we made a decision to start school on the January 3rd, 2022, which is about a week and a half ago. In that decision, it was also stated that we would monitor the situation for 2 to 3 weeks, and then we would look at the situation, at the assessment, and we would decide a way forward. 1 week and a half later, after the reopening of school, we see a couple of things. There are no recorded clusters in school. And this is also what my colleague have mentioned. It is on the report of CPS. What we also see is that we are experiencing many persons reporting ill. And this is not only in schools, but it is across the board on Sint Maarten. You have teachers reporting ill and also students reporting ill. The idea, what I heard many persons talking about, is online schooling. I want us to just understand that if you say we should go online, then you are expecting to have a teacher to teach the children online. But if that teacher is ill, that teacher cannot teach. So these are things that we must take into consideration if we are to make a decision. Students come to school, and those students come to school, at least they still have a supporting social system at school. What is advised and which has been happening last year was a simple protocol that was administered, and that is, if a child is ill, the class would stay home. If a teacher is infected, the class would stay home. And this should be done under the guidance of CPS. So what we are having is parents knowing that their children are not feeling well, they keep them home, and this is reported to the schools. So I am busy collecting on a day-to-day basis the absenteeism between students and also teachers and also staff. And I hope to be able to make a good analysis by the end of this week or in the middle of the week, because then I would have had sufficient data. Remember, I also stated that on Monday, Tuesday, and Wednesday, when school opened, you could not really have data indicating infections in the school. So I would like to join my colleague, the Minister of VSA, the Minister of Healthcare, Minister Otley, to ask all, especially the adults, get yourself protected so that we can continue to provide education face-to-face for our students. We have, on one hand, if you close the school, the next question would be, I don't have internet, I don't have data, my device isn't working. And then at the end of the school year, you would have, yeah, but the students build up a gap, and how will you take care of it? I know the situation is not how we want it to be, but we can avoid some of it and mitigate some of it by adhering to the rules. I will await any questions. It was mentioned already by my colleague, the amounts. I won't mention again how many persons according to CPS, because this was already mentioned. I thank you.
Thank you very much, Honorable Minister, Dr. Anders Rudolph Samuel. At this time, I'd like to invite the Honorable Prime Minister and Minister of General Affairs, Silveria Jacobs, to address you. Prime Minister.
Thank you, Harity Dunker, for hosting our press briefing this morning. Good morning to my colleagues. Good morning to the members of the press, people of St. Maarten, all from DCOM who are making this broadcast possible, and welcome to our press briefing of January 12th. I'd like to update, my apologies. I'd like to update on my, let's say, introduction to the new state secretary. On Monday, after swearing in, there was an amicable discussion held between myself and the new state secretary for Kingdom Relations and Digitalization, Ms. Alexandra van Huffelen, as the new government was installed on Monday as well. She expressed, I must say, excitement and a committed spirit to her new role and the responsibilities for collaboration with the countries, Curaçao, Aruba, and St. Maarten. I must state that she also had such a discussion call, introductory call, with my colleagues in Curaçao and Aruba as well. During our conversation, we spoke about the rise in COVID cases. She expressed grave concern for that and opened up to any assistance that could be given, as well as on our country's progress and the importance of Kingdom Relations portfolio as has been stipulated in their governing accord. I also reiterated the need for St. Maarten to have amicable and equitable discussions, and I must say the feedback received was quite positive. So we do look forward to in-person meetings, which she is planning to visit the Caribbean countries as soon as possible. And before that, we will individually have virtual meetings to further discuss the way forward in terms of Kingdom Relations and, of course, that held back point on the Kingdom Council of Ministers back in December. So that is still a priority for us as we move forward next week in handling our budget. And for St. Maarten, it is quite important that we receive that deviation to be able to enact the budget once the budget has been approved as prescribed by law by our Parliament. So that has also been conveyed to Ms. van Huffelen, and I look forward to being able to have that meeting, hopefully before the end of the week. From the Ministry of General Affairs, I believe it's important that I can state across the board that government is happy to announce that this year will be one in which we'll be carrying out several surveys to gather needed data for the development of legislation, policies, as well as new services. To this end, various forms of research that form part of the country package, along with research that is related to the trust fund projects and carried out by NRPB, will be executed in 2022, in addition to the regular surveys across the various ministries. Additionally, the population census, amongst others, which takes place every 10 years, is also scheduled to take place this year. This data is essential for government to better serve the people of St. Maarten. The collected data will allow the ministries to better prepare and develop needed programs, policies, legislation, and improve on our services. I'm sharing this information with the general public at this time, as it is very important to recognize that individuals may be approached more than once for different research projects and are requested to participate in surveys. We hear a lot of comments in social media, etc. Here is an opportunity for you to have your say. So in participation in said surveys and other research projects, this is where the population gets their input. So I request that as a population, as a citizen of St. Maarten, that you are patient and cooperate as much as possible to provide the much needed data and information upon which government can take necessary decisions aimed at improving the quality of life, as well as the impact of the service that we aim to give to the population. We need you and your input in order to serve you. So help us to help you, and hopefully before the end of the year, we'll be able to further extrapolate on what that data has garnered us in the way forward with our policies, legislation, and projects, as well as programs. Last but not least, I want to touch base on what has already been so eloquently expressed by our Minister of VSA. But I believe that as a government and as leader of government, I must throw in my 2 cents as well. Based on the current rise in numbers, which we had expected if we looked around the world and the trend that the Omicron had, I take this opportunity to add to the call of our Honorable Minister Otley to all residents of St. Maarten and encourage those who have not yet done so to get vaccinated. Get vaccinated, and if you're already vaccinated, get your booster. CPS has already put out some information as to the length of time that your last shot was when you're eligible for a booster. So go online, check it, call 914. It is up to us to protect each other. This solution has been available just under a year now. And I must say that it is proven to help curb the serious illnesses associated with the variants that have changed over the year with COVID-19. And it is clear, the facts clearly show that it is the unvaccinated who are suffering the most. It is the unvaccinated, for the most part, who are dying. And we do not want to lose another life to COVID-19. This has affected many, many families, and we really would like to mitigate that. So we're asking together if we can uphold the strictest protocols possible in your homes, in your schools, in your businesses, places of business, everywhere that you may go. It is up to you. If you are seeing that a business is not upholding the protocols, then refuse to do business with that business. Or, better yet, report that business to the Ministry of TEAT. I urge you to get vaccinated, as I mentioned before, and encourage those family members who may be hesitant to do so as well. We just had the holidays. So, of course, we gathered in our groups, and for the most part, once the minister gets that data, you will see that the majority of cases are related to family gatherings and or holiday celebrations. Yes, in some countries, they may have curbed celebrations. And I know when it was already on such a high level in the Netherlands back in early December, that they limited family gatherings to an X amount of people, I believe 6, I'm not sure, 4 to 6. 4. Thank you. Got a lot of help there in the room. And that was because they had already been experiencing extremely high infections at the beginning of December. So now we are getting there in terms of the numbers and the phased approach of the minister, which he is rolling out as promised, but also looking at something that hospitalization is one thing, but we have to also safeguard that our services can continue. So it is up to us to maintain the highest level of protocol. So I thank all who come to the government building to always ensure that you're wearing masks, sanitizing, and following the directions of our personnel. Be vigilant as you move through the community, as we must each do our parts to not only mitigate the spread, but to save lives, to save jobs, and to ensure that we can have a livelihood. The life that you actually save, the job that you actually save, may be your own or that of someone you love. In our recently held National Day of Prayer, we spoke of letting God's divine unity rule on St. Maarten. And if you weren't able to follow that, it relates to each and every one of us. Every person, every entity, organization, to unite in this cause that we all can benefit from. Every citizen to live up to your civic duty. St. Maarten can be protected. And if you note that there are large gatherings, do your behaving, let's call it inconsiderately, in your vicinity, you ensure you're wearing your mask and take a distance from such persons. Yes, we want to live as normally as possible, but we have to take care of each other. So with that being said, do continue to follow the protocols, get vaccinated. As I mentioned, I am boosted and I still wear my mask everywhere I go. I still uphold the protocols, except if I'm in open air. So take care of yourselves, be safe. For all of those currently in hospital or at home recovering, I wish you Godspeed and much strength to all the families as you're dealing with the current challenges that we are all facing here on St. Maarten. Charity, thank you, and I look forward to any questions.
You're most welcome, Honorable Prime Minister Sylvia Jacobs. The Minister of Finance, Artwell Arian, is present, however, will not be making any opening statements, but is available for any questions that the members of the media may have. At this time, we move on to the question and answer session, and I'd like to invite member of the media, Bibi Haj Shah of SMN News. You have the floor.
Good morning, Charity, and thank you. Thank you. Good morning, colleagues. Good morning, ministers. My question is to the Minister of Health, Minister Omar Otley. Minister, I really empathize with you with what you're going through, trying to battle this COVID-19 and the amount of active cases and hospitalized cases. I know that your days are very long. However, we have a situation, Minister, that since December I asked you about this, and that's the payment to contractors working on the new General Hospital in Cahill. Today, Minister, there's hardly any workers. The project is actually on a standstill. What I'm asking you, Minister, about the non-payment and the financial situation of now Finzo, former Inzo, is something we knew about. We warned about it. Our government, former prime minister is fully aware of all the contests and all the problems that, that took place or surfaced when this contract was awarded. I would like to know, what is this government doing right now to solve the situation at SMMC with the new General Hospital?
Thank you, Ms. Haisha, for your question. Definitely, it is a point of concern. An urgent meeting was scheduled to be held, and was held yesterday with the representatives of the SMMC/SMGH, Sint Maarten General Hospital, and also third-party meetings with myself and the main contractor, and myself and the, well, not myself, SMMC and the bank. SMMC have confirmed that Finzo is not in financial trouble. That's what they have concern. Notified me and assured me. They also called the bank, and the bank did also confirm that indeed there was some issues. Of course, this is St. Maarten. We have issues with setting up of bank accounts. That Finzo was in the process, of course, of setting up the bank account. The signatory, the notarized signatory, is now on island, will be on island today. This was also confirmed by the head of the bank, and that person will be coming in to sign. Finzo stated that they were not able to make large transactions at this moment. In my separate conversation with the contractor, he did verify that they had a meeting, and Finzo did tell them that there was banking issues and they were not able to make large transactions at the moment. So based on the information received from the bank, not Finzo, from the bank, that indeed there was issues with setting up of the account. As I've been told, the notarized signatory person will be on island today. They'll be signing, and within the next week or week and a half, everything should be set up. That was the results of the last meeting that I had yesterday. I have another meeting scheduled on Friday, as the person is entering the island today. They will, SMMC, SMGH will have a meeting on Thursday, and I will have a follow-up meeting on how everything went with the bank, all of that on Friday. That is scheduled for Friday. So at this moment, a meeting was held, the bank was contacted, and the main contractor was contacted. The main person that they owed was contacted, and both stories seem to be verified, and SMMC assured me that based on the accounts that they see from Finzo, they are definitely not financially unstable.
Thank you, Honorable Minister Omar Otley, for answering Bibi Shah's question. Moving on to member of the media, Mr. Ralph Contav from Phillipsborough Broadcasting. You have the floor.
Thank you, Ms. Dunker, and good morning to everyone in the room. My question is for the Minister of Education, and my question is, can you provide us an update on the law on tertiary education, and when can it be expected to be presented in Parliament? Because to my recollection, I think it was presumed ready late last year. Thank you.
Thank you, Mr. Ralph, for the question posed. The situation regarding the law on tertiary education is that it has already completed, it went to the Council of Advice, came back from the Council of Advice, and it is now to be vetted, and we are busy in that process. When that part is done, it's vetted by, after the Council of Advice, it will then be presented to the Parliament for, let's say, ratification. Yes, it should have been there before. I think maybe in December we was hoping that that could happen, but some technical issues, and we know that the budget was also very necessary, so we had to make some decisions, and we are working on it. And I do hope, really, it is something that we need, and I have my eyes on it, so that we can have this piece of legislation in Sint Maarten. Thank you.
Thank you, Minister Samuel, and also thank you, Ralph Contav, for your question. I now invite Ms. Daniela De Wint of the Daily Herald. You have the floor.
Good morning, everyone. I also have a question for the Minister of Education. The WITU board stated in a release yesterday their concerns regarding the current state of education during the pandemic. The union said that they have repeatedly requested a meeting with you, however, have not received a response as yet. Did you receive these requests from the union, and are there plans to meet with the board?
Thank you for your question. Yes, I have received requests from the union, from Y2 for the meeting. One of the things that happened in the request for the meeting is that the Y2 had a meeting. They had a new president chosen, and we had to wait until we got the legal documents to prove who is the new president of the union. We have received such letter, so the meeting could be planned to go ahead with the union. The comments that is being made, and I think you are referring to the comments made by Mr. Johnson. Yeah. Well, Mr. Johnson is also the manager of a school at the moment, and we are looking to see exactly what information he is referring to, because we do hope that it should not be information that Mr. Johnson is privy to in the school that he's bringing out public. When Mr. Johnson states that there are ad hoc decisions being made, he then needs to explain which ad hoc decisions he is referring to, because the Minister of Education made one decision, and that decision regarding education was for us to start on January 3rd. We have done so. I have put this in writing. And as I explained today again, the 2-3 weeks, another assessment will be made. We are gathering information as we go along, and together with the healthcare professionals, if need be, another decision would be made. So it is very interesting to hear from Mr. Johnson which ad hoc decisions he is referring to. I thank you.
Thank you, Minister Samuel, and also thank you, Mr. Wint, for your question. Moving on to Lyndon Brown of BCN TV. You have the floor.
Good morning to the people of Sint Maarten and the ministers that are present here today. Question to Minister Omer. Minister Omer, you are responsible to take away the fear from the people of Sint Maarten. A lot of people are fearful, Minister. The dissemination of the COVID, can you be more explicit? A balance, because like the emphasis is, yes, take the vaccine, of course. If there's a health emergency, people want to get better. And I want you to understand that this is not about Minister Utley. It's about people. So don't think that there's an engagement with Minister Utley. So just balance it. I mean, the emphasis, take the vaccine. Of course, it have diet, exercise, eat properly. So make the balance, Minister.
Thank you for the advice. It wasn't a question, right? But however, we have always created a balance. One thing is that we can say with this government is that we have never forced the vaccine on anyone. The MR for testing also stated test employees, whether vaccinated or unvaccinated, is a choice of the employer. We have never forced it. I've always said that even if you are against the vaccine, follow your protocols. The thing, though, that we must realize that we are dealing with something that we have never seen before. And to think that we are now going to diet for 2 weeks or 1 month, and then it's going to be all A-OK, is something that is unrealistic. Many persons who are unvaccinated have contracted the virus and have survived. And I'm so happy for that. But there are also many that didn't. And all I can do is compare numbers, Mr. Brown. Can't argue with nobody, can't fight no one. Hospitalizations, 90% are unvaccinated. Deaths, out of 75, 4 were fully vaccinated, really underlying conditions, but nonetheless out of 75. All I can do is present numbers. The hospital have had a rotating door thus far, and most of it has been unvaccinated. So while you may survive, not you in particular, but just you in general, you may survive, you may go through it being unvaccinated. There are persons that experience serious conditions. And yes, I will continue to reiterate, the vaccine does not stop you from getting the virus, but it goes to your bloodstream in which when the virus transfers to your bloodstream and tries to make it to your organs, the vaccine is there to help prevent as much as possible, much as possible, serious illnesses. Thank you.
Thank you, Honorable Minister Otley, and also thank you, Lyndon. Prime Minister, you have something you'd like to add?
Yes, thank you, Charity. I believe Minister said quite a lot. I had more notes earlier in my opening remarks that I didn't go into. But something that government has been working on is promoting health, promoting movement, promoting not only that, getting enough rest and building your immune system. A lot of persons, even those who are vaccinated, because you're so mentally stressed by the situation or whatever else you're going through, you're also making your body vulnerable to infections. It could be this virus or it could be any other. And what we are also forgetting is that it is flu season also. So many people are also just sick with the flu, the regular flu, which can have serious effects for persons with underlying issues. Prior to us having COVID-19, the flu was also a SARS-1. And I know for a fact the elderly and some other vulnerables were always vaccinated around this time, November, December, to prepare for that season. Many people travel from the US and Canada and Europe, etc., and it's flu season there and it comes here. So what is happening with COVID happens every flu season. It is just now, let's call it, amplified. And we're seeing the negative effects that it is affecting many areas. And so I encourage within management, within different stores, as well as department, to monitor, because when I've checked with my Secretary General, there wasn't a high number of absenteeism within the Ministry of General Affairs. Of course, other ministers can speak for their ministries, but we already have our protocols in place. The civil service was reminded of the protocols and keeping those while working. So once people are in the same room with others, they must wear masks. They must continue to sanitize and wipe down. But taking care of your own body is your priority. Ensuring that you're healthy, eating healthy, getting enough rest, exercise, and drinking lots of water and fluids. So I encourage the people of St. Maarten to also do that. And thank you, Mr. Brown, for your comment.
Yes. Thank you, Prime Minister. Also, thank you, Minister Otley and Lyndon for posing your statement. Also, moving on now to our second round of questions, Ms. Bibi Hartshaw of SMN News, you have the floor.
Thank you, Charity. I'll ask the Minister of Health a clarification before I go into my second question. Minister, I understand your explanation fully well, but can you tell me how long the project at the new General Hospital started? If I remember clearly, this government is in office 2 years now, and this project started before. So why only now Finzo trying to get an account? Why only now the official transfer is the Finzo? And what about the signed agreements that Finzo is not living up to with contractors? So if you can explain that. And then, Minister, regarding the spread of the virus or the flu, whatever it is right now, a number of people getting tested. We hear about phase 1, we're now at phase 2. Should the numbers continue to rise, what's the next step?
Thank you, Ms. Harshaw. The project, when I first got into my position, I was asked to come to Parliament. In presentation with the Parliament, SMMC made their presentation and stated that the project was on trajectory. There was a few months delayed due to COVID, etc., but it was on the right trajectory. So even as INZO, the project has started and has commenced. There were some changes with the mother company where some buyouts happened in foreign, in Italy or wherever, the name changed from INZO to FINZO. The official changing happened only about 2 months ago, 2.5 months ago, that I was notified, Minister, it's officially FINZO. I knew the process was being carried out, but I was notified 2 months. So as they were operating as INZO all along. They had a account here as INZO. So that was already set up. But once the change happened, of course, you cannot operate no longer as INZO. This is something that we have all complained about, every parliamentarian, the time it takes to set up bank accounts. My main concern, definitely like the people of St. Maarten, and I told them, I said, it's time we have a positive outlook on this project. From the beginning, it has been nothing but negativity. I was happy when we did the job fairs. That's one of the things I stressed on. I said, I cannot be involved in the day-to-day activity. I can only look out for the people and do what I can within legal realms. So my thing is, and one of my questions is, we had a job fair. So I should expect to see more people on the job site. I was then updated about that. The minister, they gave me a list of persons that had second and third interviews. They gave me a list of the process of persons who will be hired. They also gave me a list of persons who did not make it, but some will be transferred to NEPA. So that's good. So I put a strict deadline within the next coming weeks. I expect to see an increase in manpower immediately. And like I said, we contacted the bank. I didn't take the word of the contractor. Contacted the bank and contacted the main contractor that is owed money. So that's that part when it comes to FINZO and INZO. With the spread, unfortunately, baby, we cannot go into a full-scale lockdown. I pray that they don't even come to consideration, but we cannot. I still maintain, though, although we are at phase 2, I still maintain my approach of not to panic. It's simple logistics and it's simple numbers. Like I always say, even if you have a 1% hospitalization, as the number goes, and 1% will go up. But what we are noticing is that people are coming to the hospital earlier. So the numbers are forever adjusting if we realize. Because people now learn that don't wait, they come earlier. So when they come earlier, they come at an acute state, and then they are able to leave, whether it's 3 days, 2 days. We notice that the hospital take you for observation, and if we take you, even if it's for a couple of hours, we have to report the numbers. So it's a revolving door, unfortunately, but thankfully that persons are not, staying in the hospital. With the increased protocols, with the scale back, one thing that is proven, history has proven it. Every time we scale back, the numbers has decreased. Every time we scale back, the numbers have decreased. I am also one that says COVID don't live only at night. That's the reason we stress on daytime compliance. That's the reason we do the daytime inspections. But the reality is we hope now with the inspections going on, with the compliance, with the fines being given, I just read the report, with the fines being given, and with the increased ever-changing measures that we will implement as we go, we will only tighten up and hope that we can still maintain some economic activity to keep us afloat. As I will reiterate, and I will continue to reiterate, I have my good minister to my right of me. We have no liquidity support for January, February, March, no SSRP, no food voucher, which fed over 12,000 people. So we have to take it into consideration.
Thank you, Honorable Minister Otley, and also thank you, Bibi. And I'll move on to Ralph Contav of Phillipsburg Broadcasting.
Thank you, Ms. Dunker. I have another question for the Minister of Education, but just have a short follow-up to your previous answer. Considering, of course, there will be the budget debate for 2022, do you have a deadline at least for the law on tertiary education? And my actual question, and my actual question is, having spoken to a few professionals in the education field, there are students as young as ages 10 to 12 who are caught up using drugs, and considering the mental and social challenges of these students, what is being done to address this concern and prevent others from going down this negative path? Thank you.
Thank you for the question. Putting a specific date on the finalization of the law on tertiary education is a challenge, because you have to also take into consideration the rights of Parliament and the time that they need to debate the law when it reaches there. As I have informed you, we are busy with the final review of the vetting of the Council of Advice, and when this is done, then it is presented to Parliament for vetting. The statement you make, you have spoken to some professionals, and they are talking about drug use of persons. Now, that is such a broad statement, and then the question would be, if someone knows of the drug use of a person, what they themselves has done with the information. Because if the information is not brought to me, I don't know exactly which area to go and look. I have 7,000 students, and with a statement like that is so broad, it is very difficult to work with information like that. I thank you.
Thank you, Honorable Minister Samuel, and also thank you, Ralph Contav, for posing your question. And I'll give the floor to Daniela DeWint of the Daily Herald. You have the floor.
Thank you. I would like to direct my question to the Prime Minister, since the Minister of Tourism, Economic Affairs, Transport and Telecommunications is not here. Given the quickly rising numbers of Omicron cases around the world and its effects on employees calling in sick, especially in the food industry, coupled with the global shipping problems, are there any concerns about potential food shortages? And if so, what is Sint Maarten doing to combat any potential future shortages?
Thank you, Ms. De Wind. The Minister of VSA is actually the acting Minister of TEAT. So, Minister?
Thank you. Definitely all around the world, we noticed that there's issues with shipping. There's various, we were presented not too long ago by the Ministry of TEAT with various options on how we can import foods. If we talk on the safety aspect, of course, where depending on where we get our sources from, that's where I come into play. The inspection will be done on what is imported. But definitely this is something that was brought to the attention of the We understand the logistics. We understand the increase even in pricing of food because of the problems that we have with shipping. So the Ministry of TIAT is indeed looking into different sources, looking into within the region as well, with different countries and islands that that benefit off agriculture, and see what type of relations we can create to then pool our resources together within the Caribbean region and to benefit the island.
Thank you, Honorable Minister Omar Otley, and also thank you, Daniela, for posing your question. Last but not least, Mr. Lyndon Brown of BCN TV, you have the floor.
Question to the Prime Minister, Honorable Sylvia Jacob. Statement. St. Maarten, Curacao, and Aruba was always working together, Minister. Now the new Dutch government is installed the 10th of January. And of course, they have been pending discussion, a dialogue. Now, what is on the front burner for these three islands towards the new Dutch government? What is burning and that these islands want to deal with right away?
Thank you for the question. I believe in my opening statement, I mentioned that all three countries had initial discussions with the new state secretary. We have our own relationship as basically a tripartite, as three Caribbean countries. All of us stood strong or together in requesting that the agenda point related to the countries was held based on the decision that could be taken based on the fact that we're in a minority in the Kingdom Council of Ministers. So for all three of us, it is important that we go to the table and assess the position of the new state secretary. She has introduced herself as someone willing to work amicably with the islands, that she has the interests of the islands at heart, and is willing to actually come within short to see the situation in each country. So the main thing that all three countries are faced with, thing that we all face right now, is the deviation from the budget norms to have a balanced budget. So we present a budget by law to the Parliament for approval. All three countries, Curacao already approved theirs, but they're awaiting the deviation from the budget norms to be able to enact the budget. The budget is also connected to some of the reforms that you've already agreed to. So withholding that legal right of being able to deviate from the budget actually goes against the rules. So we as three countries would like to see that handled with haste, and then we continue with any discussions related to the note of wijziging or the note of amendment to the COHO law. There were many technical discussions on it, but it's back, let's call it, to the technical discussion, and the government will then take a decision on it. But we feel that in no way or place that that should be a condition, the deviation of our budget right, or the right to have an unbalanced budget, seeing that all three countries are going through the pandemic, the worldwide pandemic, which has negatively affected our finances. And as St. Maarten, we haven't come off of the non-quite recovered from the hurricanes Irma and Maria. So the CFT has positively advised on this, and so that is the first point that we as countries see as important. Of course, each country has other points, and I think Curacao, Aruba has already highlighted that the protocol, that they're back in discussions related to their financial supervision. But all three of us face the same issues with not having the deviation granted by the EDMER as is customary and has been done for us in Maarten since 2017, when we have been below our income as normal. So with that being said, I look forward to very positive discussions moving forward, as the first one gave a renewed sense of hope in that direction. Thank you.
Thank you, Honorable Prime Minister, and also thank you, Lyndon. Members of the media, I'd like to thank you very much for being a part of this morning's press briefing. For any further questions, please direct those questions to the Minister's Cabinet. Honorable Ministers of the Council, members of the media, online viewers, and radio listeners, this brings us to the end of the Live Council Ministers press briefing. For a rebroadcast, tune into St. Martin Gov Radio 1079 FM. And also tell TV Plus. For video on demand, log on to the official government's Facebook page and YouTube channel, Government of St. Martin, and also TV 15. On behalf of the Department of Communication and the Government of St. Martin, I am Charity Dunker, bidding you a pleasant day further.